Hello, I am Naigaga Kulsum. Today I would like to explain how difficulty in communication can present in a child living with autism spectrum disorder. There are behaviors that can be observed, and I'm going to give some examples to make us understand. 1. Delayed speech and language. Usually, most children say their first words at around 18 months of age to about 24 months of age. That's like 1.5 years to 2 years old. But a child living with autism spectrum disorder may take longer than that. They may make 3 years, 4 years without actually starting to speak. 2. Failure to respond to instructions, including simple instructions. Children can manage to respond to simple instructions like come, go, sit down, stop doing that. But a child living with autism spectrum disorder may find it hard to actually respond even to such simple instructions. 3. They may fail to communicate their own needs or wants. A child may want to go to a washroom for a short call, or they may want to drink water or be hungry, but then they may actually fail to communicate that to their caretaker. A child oftentimes also fails to point to objects of interest. That is the 4th way. When children have not yet learned how to use words and language very well to communicate, they actually point to objects of interest. For example, when they find an interesting toy, they will point to it and the caretaker will look towards that side to know what they are talking about. But a child living with autism spectrum disorder may fail to also point to objects of interest. There are a number of other behaviors. Those are just only a few examples which we can look at today. Despite the difficulties in communication that a child living with autism spectrum disorder faces, they can improve in their language and communication skills if they are provided with speech and language therapy. I'll talk about speech and language therapy in an upcoming video. Thank you.